Thank you very much for joining us for the plenary session of the AUR. As you all know, the theme this year is leadership and transformation affecting positive change. And really, as we've seen, as healthcare undergoes some major transformations in front of us, leadership and change management have never been more important. Many of you are managers, your chief residents, your program directors, your chairs, your division chiefs. You're managing, and management is going to be important. But as Peter Drucker said, management is doing things right, while leadership is doing the right things. So whether you're a manager or not, everyone in the room can be, and I hope will be, a leader as we work our way through the challenges of the coming few years and probably the coming decade. In academic medical centers, we actually have a number of challenges, as you know. We are only 5% of hospitals, but we deliver 25% of care to the people of the nation. And in fact, we deliver 40% of indigent care. So making sure that we as an academic community and we as academic radiology can contribute to moving healthcare forward in the nation as we go through these transformations, these changes are incredibly important. As Mark Twain once said, always do the right thing. You'll gratify some and astonish the rest. And it's really important more than ever that we do the right thing through our leadership of the field. It's a real pleasure for me to introduce our speaker, our plenary speaker. Anne-Michelle Gundlach is the interim program director of the Masters of Health Administration program at the Johns Hopkins University Bloomberg School of Public Health, where she also serves as the co-director of the MPH program's Health Leadership and Management concentration. She's taught and consulted on healthcare sector projects in Southeast Asia, the Middle East, Latin America, the Caribbean, and throughout the US. Prior to joining the Bloomberg School in 2003, Dr. Gundlach spent over 25 years consulting to both public and private sector organizations throughout the United States. And the focus of her work has been on organization strategy and change with an emphasis on leadership development. Again, as we move through this coming time of turbulence and change in healthcare and in academic radiology, I'm certain that some of the concepts and ideas that she's going to share with us will be really pivotal. So without further ado, I'd like you all to join me in welcoming Dr. Gundlach for our plenary session, our 2014 plenary session. Dr. Gundlach.
Good morning. Is this better? Good morning. It's an honor to be here, and it's always nice. The room is filling up more. This is it's always good to feel as the chairs get more full. All right, I am going to spend, I hope, the next hour and a half piquing your interest in why we are entering a time where this is no longer just an academic topic that people roll their eyes about, but one that will make a considerable difference in how the health sector deals with turbulence. We're really not known for dealing with turbulence well. We talk about it a lot, but we have been celebrating stasis for longer than a lot of us may realize. Thus, the title of my talk with you today, Leadership Change and Change Readiness, because organizational readiness for change is the purview of leaders, something we often don't think about. It just doesn't happen to us. It is something that is deliberate, intentional, and essential, and I think we owe it to the people who look to us to know what it is we're doing. I've had the good fortune over the last few decades of working with leaders in healthcare throughout this country, clinical leaders, physician leaders, organizational leaders who have, if any of you remember what started happening in the beginning of the 80s with prospective payment, and we thought that was bad. And then the roller coaster kept going. But because there was so much confusion, or we were tweaking so many things, we weren't required to make the kind of change that required a level of organizational resilience that it does today. And so I've learned a lot from the people with whom I've worked. I've learned a lot from the students who, the best thing to say, teach me so much about a world that's changing for them too. And so what I'm going to try to do for you is give you a couple of things that you might leave today with to think about, because I think a lot about leadership is thinking first and then doing next. And so my goal is to take you off the balcony. I think a lot of the things we often talk about when we deal with leadership is on the balcony. We kind of look down at greatness, those people who we look to as icons of models, which many of us either don't aspire to or can't relate to, and so we put them in a different class from ourselves. I'm going to ask you to put yourself on the ground, and I'm not speaking about the people for whom you work. I'll be speaking to yourselves. And so I'd like you to think that way as we go through this together. Let's begin. I'm a real big fan of Gary Larson's. Hey, they're lighting their arrows. Can they do that? We've been saying this for as long as I've been in healthcare. We've not only been saying, can they do this, but we're presuming that they can't. They really don't know what they're doing, so we're going to wait it out. This is not one of those times. They not only can do it and have done it, but those barrels aren't protecting us anymore. And so part of our learning is going to have to be dealing with what is less predictable. And the world of healthcare, many worlds, but especially in health, I think we are somewhat dependent, but also expectant that we'll be able to predict, and thus we'll know what to do. If we can't predict, we'll wait and we will diagnose and then prescribe. The medical model does not meet the challenges of an environment that is asking people to think forward. And so we're in a stage, and I use this word very carefully because this is another eye-rolling word. We are truly in an age of a paradigm shift. And the paradigm is in practice. Suffice it to say, we come from a world in which the more you do, the more you get paid for. And that incentive has been a very controlling incentive. It shaped not only what we do, it shaped how we teach, not just how we practice. Well, we're entering a world where they're not only doing this thing called bundling payments, right? But they are going to pay us for the outcomes we get as opposed to the activities we do. That's a shift in the way we see the world. And one of the things I have learned over these few decades, I have great respect for organizational culture and how difficult it is to change. But one of the things you learn when you're in a role like I have been in these many years is that you want to change something, change how people are incented and rewarded. Sometimes we appeal to their better nature and their visionariness, but actually change the reward system and all of a sudden people's behavior, not all, but most, begins to take a shift. And so, this should give you an idea how I'd like us to begin thinking about what the role of leadership is in this kind of environment going forward and over the next decade. And so I have a question I would like you to think about, but what I'd also ask you to do is, it looks like you're all sitting next to somebody, so I'd like you to take 2 or 3 minutes and just discuss, to whet our appetites, this question. What are your expectations of people in leadership roles? Take a couple of minutes, please. have a second question for you. Okay? Here's your second question. Why do you think we are so often disappointed in our leaders? Okay, if you could finish talking about your disappointments, I'll start again. Okay, given the time and the size of the group, what I'm going to do is share with you some of the responses I get from groups like yourselves when I ask this question. These are some of our expectations. Very few people don't almost say first. They expect integrity. They want their leaders to have a sense of the future. They want to be inspired by the people who are leading them. We also like decisiveness. We may not like the decision, but we like decisiveness, and we like people who can bring people together. These may have been some of your responses also. And here are some of the disappointments. The first one is the classic. Those who don't walk the talk. What they say and what they do are very different. And you know, we are social beings. We miss nothing. We see it all. We don't like self-centered leaders. We don't like people who are out with themselves. It's what gives organizational politics for themselves. It's what gives organizational politics a bad name. We also don't like non-participative people, especially those folks who ask us our opinion and then hope we leave the room quickly. We're often very disappointed in poor communicators. Can't he get his message straight? Why isn't he speaking? Why isn't she saying what she means? I don't get it. And we also have no tolerance, generally, for dishonesty. No matter how good you are, kind of is a red X, and we move on. And the reason I like to start here is because I like people to think about this question. And it is, what do your responses say about yourself? Leadership is self-development. We can't learn to lead on someone else's time. Most of us can't learn to lead in a classroom and then walk out and all of a sudden be that which we have been told about. And so the process of becoming a leader, no matter what level you serve at, is the process of spending some time with yourself, what you think, what you know, and what you believe. So let's go back to Gary Larson. Come on, it's either one or the other. Right? Now, some of us go through life this way. But what I have found in organizations is there was a time, and for some people there continues to be a time, where we think, it's a binary, just pick one. Pick one. It doesn't matter what you do, because the same thing's going to happen. That's not true anymore. We are dealing with a level of complexity that, by the way, most people want to put behind them. It's a level of complexity in which the answers to our questions are not necessarily clear, not because we don't know the answers, but because there are multiple answers to things we have not yet done. So we come out of a time, and I think we are, in many cases, still in that time where having the answer isn't essential. That's not going away. We spent too many years becoming who we are for that to be going away. But what is going away in organizational life is the obvious. And in clinical practice, what is going away is the historical obvious. So we've got things to think about in relation to what stays, what goes, and what kind of resilience we need to join that journey. Thomas Lee, some of you may know about Thomas Lee. He wrote a terrific piece for Harvard, the Harvard Business Review a few years ago, and he called it Turning Doctors into Leaders. And I feel like he and I are like minds, so I wanted to share some of his thoughts with you because I think you are all, to a lesser or greater degree, growing through this. But he talks about the changing landscape of physician leadership. And the first thing he talks about is the increasing fragmentation and chaos. Some people would say, well, it's always been fragmented and it's always been chaotic. Yeah, but that's when it didn't matter as much. The fragmentation is now going to get us into trouble, and we can't integrate chaos. The explosion of knowledge and technical advances requiring change that you are leaders in the world of health regarding. But often what doesn't get talked about is you can change technology in a nanosecond. You don't change human behavior in a nanosecond, and it's human behavior that's required to adopt the technology, use it correctly, and lead forward with the changes it's going to really make and making things better. Increasing reliance on teams and changes in practice. Not for all, but for a significant majority of clinical practitioners, you're solos. And we're proud of that autonomy. In fact, autonomy defines medicine, especially for patients. Well, we have entered a time where collaboration will define practice. Many of you have already entered that realm, and many have not. But collaboration, working in teams, requires something called power sharing. And it's not something we're taught well how to do, or people suggest is a very good idea. In addition, he talks about performance measurements shifting from what it is we do to the quality of our outcomes. Now, we're all hearing this, but as it begins to sink in, it's going to require us to master how to get our patients ready, our colleagues ready, and staff ready for looking at what we're producing, not just what we're doing. And so I wanted to share this with you at the beginning so I can build on it as we move. And so here's one of my favorite graphs, or one of my favorite charts, because I think it begins with this. The managerial mindset and the clinical mindset are different. We're trained differently. Now, some of you in this room may have sought training in management and leadership. Some of you may have MBA degrees or other degrees or certificates that you started to dabble in. How do I understand this so I can sit at the table where those cost-based decisions are made? But the reason why I think this is important is because I think brain training matters. Whether you're a physician, you're an organizational leader, you're an attorney, you're an engineer, Your brain is trained in a certain way to see the universe. So you start with primary allegiance. In the managerial mindset, it's to the organization. For most clinicians, it's to their patients. Correct? That's who you're working for. Responsibility in organizations is absolutely shared all the time. In fact, compensation systems today, more than ever before, especially in the C-suite, is based on shared goals. But responsibilities in clinical work usually is not only individual, but it's very personal. Authority relationships. Organizations are by design, especially in the health sector, hierarchical. It's not that medicine is not hierarchical, but it's more collegial. There's always somebody at the top. But walk into a room and the expectation is we're colleagues. Time frames. In organizational life, sometimes it's really hard to measure things in less than a few years. So the time frame has got to be long. It's looking into the future. And the capacity to deal with the ambiguity that creates, and it requires a real tolerance for ambiguity, is very different from your expectations of, we need an immediate and concrete response. We just did an exam. We just did a test. We just took a picture. Our patient is waiting to find out what it means, and so are we. So in organizational life, we have this very different level of feedback that we can count on when you're leading an organization forward than when you're addressing patient issues. And finally, the tolerance for ambiguity I spoke to, which is got to be high, by necessity got to be low. Neither of these columns is correct. It's just providing a way to understand that when you sit at the table with people who think differently than you, and you're trying to make decisions together, your lenses are different. I have been dealing with this for 3 decades. The lenses are different. They're not correct, they're different. Now, if the goal is to come out of this with a shared approach to what it is we're going to do, the understanding of those different lenses makes for dialogue and then makes for joint decision-making as opposed to drawing the battle lines. I have heard so often over these years from folks how some docs go over to the dark side. You know, they work with those folks in the C-suite. And I say, oh my God, I work in the dark side. You should hear what the dark side says about your side. But the more we get, the more we grasp this, the more we understand the future is about, you don't transform solo, you transform conjointly and through dialogue. And so I wanted to share this with you to give you a sense of how I think and what I bring to when I work with my clients. And so this sets up the premise for what I believe about leader development, and it is that leadership is about character. It is not just a superficial question of style. It has to do with who we are as human beings and with the forces that have shaped us. The process of becoming a leader is much the same as the process of becoming an integrated human being. The way you affect the lives of your patients, when you are in a leadership role, you affect the lives of those people who work for and with you. And that is an extraordinary responsibility. Knowing who you are and how you are who you are is a critical component of effective leadership. We thrive on effective leadership. It makes all the difference in our lives and in our work. And so I'll move on to some of the assumptions that underscore the way I think and what I would like you to possibly take from my session today. So let's start with the first one. Leaders think differently than non-leaders. Not better, differently. We want them to think forward. We want other people to think focused. We want our leaders to think differently. They have to think differently because they're supposedly taking us somewhere. So stasis is not an option. Leader commitment and passion are not mechanical. They must be authentic and purpose-driven. And I saw you had multiple sessions throughout this week on the theme of the conference on leadership. And I'm sure you got from these sessions, you don't get to behave a certain way and it works. Years ago, God, back in the 70s, the Ford Motor Company adopted something called behavior modeling. And they took all their supervisors and brought them into training sessions and taught them what to say. These were the guys who were on the line with the cars. They taught them what to say to their employees. And if they said this, they could expect their employees to say something back. So if they were disciplining their people, you say this, they'll say this back, you say, and everything will be fine. And then they'll go back and okay, so what did the supervisors find out? The employees didn't go to the same workshop. So they had no idea how they were supposed to behave. You might have the passion, but it must be genuine. We know we are sensing instruments, and we know when we're dealing with an ingenuine person. We expect genuineness in our leaders. Next, felt leadership is essential, especially in times of change and uncertainty. And what I mean by felt leadership is that the organization, the unit, the department knows there is a leader there. That there is someone in charge. There is someone who has their best interest at heart. And we have organizations in which we know there's someone around, or we don't know where they are. We always look up. So felt leadership is critical, and you determine how much your leadership will be felt or not. Good leaders are good teachers. There is not a person in this room, I am sure, who doesn't have a teacher in his or her history who made a difference. And I can tell you, because I have physicians in my classes now, I have residents in my classes, I have this plethora of all different kinds of folks. They just don't wear suits, so you don't know what they do. And they all thrive on good teachers, and they talk about them. Good leaders are good teachers. They change lives. And lastly, the only leadership is ethical leadership. There is no other kind of leadership. It defines us. Our integrity defines us. These are the things that underscore how I work with people in leadership roles. So that there's a sense of, it's really not magic. You don't go into a room and have a vision. It's not magic, but it's about being a whole human being with intent, focus, and a good sense of humor. All right, so moving on. Let's just start cutting and see what happens. I love this. The New Yorker is my therapy. I use this because there is not a clinician, a surgeon in the world who would say, oh, sure, let's go in and see what happens. But somehow we think often with leadership, what's it take? You go and you tell people what they need to do, you give them some goals, and everybody walks out and they're happy. Or not, but that doesn't matter, but I did my job. We must learn, practice, study, and apply the principles of leadership as we do clinical practice. It's affecting the lives of people in ways we often do not appreciate. I have been looking at Gallup polls for the last 3 decades. They do some of the best organizational research in the world, and there is not one year I have looked at these over all of these decades when one of the top 5 is always, my relationship with my supervisor matters. We often don't have any clue how important that is to the people who work for us, but we know how important that is to us in relation to the person we work for. So do keep that one in mind. So moving on, I think it's important that you have a sense of how this person even defines leadership. I think definitions are important. So this is the classic, right? Leadership. And this is not going anywhere. This is not changing. It means getting others to undertake some form of action as determined or influenced by the leader, an action they would not necessarily have taken in the absence of that leader. So that's the classic. But here's where I believe we are, and I am convinced we are going in the 21st century, and it is this. Leadership is a dynamic relationship based on mutual influence and common purpose between leaders and collaborators, those folks you work with who you may not have any authority over, in which they are motivated to achieve real, intended change. And the key words in this way of understanding the difference in leadership as we move forward is relationships and collaborators. We now are often responsible for influencing people over whom we have no control. They don't report to us, they don't work for us, we don't pay them, we don't do their performance evaluations, but we need them to cooperate with us for us to get our work done and to get it done well. And the command and control model of leadership, as I'm sure most of you know, it's on its way out. It will never leave some of us. But the vast majority, it's on its way out. Command and control doesn't work. And if there are any millennials in the room, oh my goodness. Okay. So I work off of this definition in terms of shaping skill sets, shaping mindsets, and appreciating our need to understand how to influence and how to negotiate with people, which we may not have been professionally trained in because it really wasn't important on our way up. Or it certainly isn't important in medical school curriculums because I work there. And we have people begging for them. Okay, so moving right along. Perspective is always good. So here's another way to gain some perspective on what I'm saying. And so let me start with this. Many of us, not all, but many of us have come out of what might have seemed like a time where there was considerable continuity. But we are living in an age, these past few decades especially, but right now, of discontinuity, not just on the global stage, but on the national stage. In concert with that, I don't know anybody who doesn't thrive on certainty. I like certainty. It's a really good thing. Except we live in an age where things are more uncertain than they have been before. Not everything, but a goodly amount of things have become uncertain. And so the certainty that has defined us can make us a little uneasy and on edge when in fact what we know is not necessarily what's going to be useful in what's being required of us. Which leads me then to, we also like clarity. I don't know anybody who doesn't like clarity. However, we're living in an age not just of discontinuity and some uncertainty, but also ambiguity. You don't like gray films. You don't like confusing results from the tests you make. Well, in organizational life, gray is the new clear. And where is this taking me? It is taking me to this. We have come out of an age of knowing where what we know has defined us. And what we know will continue to define us, except that what now is going to be causing lots of trouble, has been causing trouble, but now more than ever, is that we are living in an age where our learning capacity is going to make the difference. And I don't mean classroom learning capacity. I mean learning in real time, taking in all the information we get, using it and applying it to a time where things are more uneven than they have been before. Healthcare has been fortunate in that kind of circled the wagons a while ago, and nobody told us any different. we were really pretty okay with our circled wagons. Okay. And so I like to use this because just to get a little bit of perspective that you can also share with your folks when you go back, which is we're counting on the left side of the chart, we're spending a lot of time on the right side of the chart. How ready are we for that? Which brings me to one of my most favorite quotes, and that is, walking naked in the land of uncertainty and getting lost with confidence. And that's kind of what's required of us. And the case I try to build that I think we can get lost with confidence if we have a sense of what some of the expectations are. How the authority food chain that was set a long time ago is in for some reshaping and redesign. Our organizations are designed more often than not to respect autonomy and separateness, and integration rejects that, as does a healthcare reform environment that is expecting people to work together. The professional hierarchy I think most of us have grown up with rejects power sharing. And power sharing is a direction we're all going in. Some of us have more experience with it than others. So, Robert Quinn, Deep Change, walking naked in the land of uncertainty and getting lost with confidence. So this brings me to the bookend for that piece, and that is this, and something that I find, again, people in leadership roles may not necessarily appreciate, and that is leaders shape and frame the message and the meaning. And if you are leaving it up, whether you are in a leadership role now or you aspire to be in one, if you are leaving it up to someone else to shape the message and the meaning, it's an abdication of the influence you can have on so many people. How do you want the folks with whom you work and who work for you to understand the meaning of what is going on and what the expectations are? If you allow the news media to shape it, if you allow the newspapers to shape it, if you allow people in the organization who really don't quite understand what it is you do, but they know you're in charge of something, to shape it, you're abdicating what could be an extraordinarily influential component of what it is you do. Leaders shape and frame meaning and message. And I think it requires you to be very thoughtful. How do you want people to understand what is happening? How optimistic are you? Because, by the way, we don't follow pessimists gladly. We don't. We put up with them, but we don't follow them, and they're sometimes really tough to take. And so, keep in mind, as you shape the message for other people, it's not that, well, we do not see things as they are, we see them as we are, right? We see them as we are. Let me take you back to 1949, when a lot of us weren't even around. Some of us were, but all of us weren't. In Chicago, University of Chicago was doing some of the best perception research in the world. And they did a very, very famous experiment that some of you may be familiar with. And what they did was they took a deck of cards and they changed all of the spades and clubs to red and all of the hearts and diamonds to black. And then they lined up the 3,000 people and showed them the deck of cards and asked them what they saw. And you can guess what they saw. Black spades and clubs and red hearts and diamonds. Because it's not, I'll believe it when I see it. It's, I'll see it when I believe it. And so leadership has a lot to do with shaping and changing what people understand and value and believe in relation to what the work ahead is. And so it leads me to what I talk about a lot, which is, and so you got to know you. You got to know how you see, how you don't see, what matters to you, what doesn't matter to you, because it's going to affect how you influence other people, directly as well as indirectly. So I thought, given that this is one of the themes of my talk with you, that I have a little quiz for you to take. You don't need to write anything down unless you want to. You can keep it in your head. So I have some questions for you to consider. As I'm sure many of you have heard of this thing we call emotional intelligence and social competency. Well, what's so important about it? What's important about it is we've got now enough retrospect and enough validation to know that it matters, that emotionally intelligent and socially competent individuals are more successful in life and work than others, and we're beginning to use it in the training of people in the health sector. So I'm going to start with some statements and questions, and you can answer them in your head as we go along. So let's start here. How aware are you of your own strengths and weaknesses? How aware are you personally of your own strengths and weaknesses? Second question. How aware are you of the impact of your emotions on other people? Or not? Third question. How well do you understand what motivates others, especially people who are different from you? That's a big one. 4. How sensitive are you to others' needs? How well do you listen for what's important to other people? As opposed to what you're going to say next. How effectively do you persuade others by considering what's important to them? How often do you get support from key people instead of going solo? Next question. How often do you provide performance feedback and coach others? How well do you inspire others by articulating a positive vision or a positive sense of the future? How well do you engage others, solicit input, and encourage cooperation? No more questions. Okay. Those are just samples of questions that are asked in instruments that are designed to measure emotional intelligence and social competency. And this is the model those are based on. I'm sure some of you are familiar with this model. It's divided into personal competence and social competence, and suggests that to be whole and wholly effective, it starts with you got to have self-awareness. You've got to know who you are and how you affect others. You need self-management. And by the way, I have used this instrument wherever I have been in the world, and while there are cultural differences, everywhere, of course, these things slide across borders. Self-awareness, self-management. Social awareness. When you walk into a room, do you grasp what's going on in the room? Can you identify where the relationships are amongst the people sitting at that table? How do you know who's in charge? Now, there's some places you know who's in charge. That doesn't take much awareness at all. And lastly, relationship management. How much do you try to understand about what's going on with the person you're trying to convince? Because every conversation is a negotiation. A relationship negotiation, no matter what the conversation is about. We are negotiating relationship in the way we speak with people, in the way we interact with people. We don't get why they didn't understand us. We were well-meaning, but we were in a rush. So this is the model, and I would encourage you, if you haven't yet, to maybe explore a little bit beyond what we're doing today. The whole notion of how do I affect other people, how, in terms especially of the influence you want to have in an age of change. So, know where your work is. We all have work. Know what yours is. Pick one thing and go ye forth. Okay, so in order to now get to, so what do we do with all of this? It is leaders who help develop organizational readiness, right? That's who we look to do that, to start melting, unfreezing what the organization doesn't know, and leaders legitimize moving in a different direction. Nobody else does. Okay, so moving to my next question for you. What characteristics make an organization able to work with and respond to dynamic and disruptive change? Again, what characteristics make an organization able to do this? Think, if you will. And as you're thinking about this, obviously think about your organization. Think about its capacity to respond to disruptive change. We love disruptive change when Apple comes out with a new product, right? We love it. We love disruptive change when Netflix comes out with a new program and challenges all the other ways of knowing how to deliver movies. That's disruptive change. We love invention, because invention can change the world. Yet we work in social action systems and organizations. My God, disruptive change, we have work to do. And so let me share with you some of the cultural characteristics that explain some of this and those that get in the way. So there are enablers in all organizations that help organizations respond to disruptive change and adapt. The top one, bar none, is strong and visible leadership. Okay, we know this. But then there's transparency. And I have worked with more people now that say, what is that? How much do you have to give them? You can't give them everything. You can't tell them everything. But what we know that helps organizations adapt is how much they know. Usually, the top echelon knows, whether it's the clinical echelon, the medical echelon, or the organizational echelon. They know. But by the way, they're not making the changes. The changes are active on the ground, not at the balcony level. So transparency, how much do we allow people to know so that they understand why they're being asked to adapt even though they're not happy about it? High trust. Trust is glue, period. Trust is glue. Walk the talk or walk it back and come back again. A collaborative environment. We know collaboration enables resilience, and collaboration enables people to adapt better. We know it because they're in groups and there is this thing called safety. And finally, a proactive orientation. There are absolutely fascinating studies in the organizational sciences regarding the impact of pessimistic versus optimistic outlooks. And we are experiencing some real cacophony in the way our leaders in healthcare are communicating about reform, transformation, and what's required. It makes no sense to set up our organizations and our constituencies to think whatever is happening is wrong, it's going to get voted down, or we can ignore it until they come for us. Because we don't respond well to pessimistic leadership. We tolerate it because, by the way, a lot of us are used to it. But we thrive on and we so respond well to optimistic leadership, not, happy, cutesy, dancing around leadership. But optimistic leadership, we can do this, we have to understand this, we're up to this, how are we going to approach it, and how long do we need? Because it's not going to happen overnight. And these barriers, by the way, have been around the healthcare sector for as long as I've been in it. We epitomize risk averse. We love benchmarking. We love to find out how other people are doing it, by the way, for which there's nothing wrong, except when there are no benchmarks, except when nobody's done it yet. So we are not necessarily skilled in experimentation except in the lab. And so we need to learn to become a bit more risk-oriented in terms of the way we manage our organizations, not put our patients at risk, but manage our organizations and practice our work. A lack of a clear vision. I sat with a CEO many years ago who we went into the boardroom and he sat there and he said, "So how do you do this?" And I realized what we've done is kind of set it up as you got to have a vision. Once you have a vision, everything will be fine. No, how do you think about what's going forward? How do you make sense of it? And then how do you shape how you make sense of it for your organizations? Emphasis on status and hierarchy. Now, we could go on for an entire separate session on status and hierarchy in academic medical centers. I've worked in many of them throughout the entire country and know how important it is, how people spend their lives working for the rewards and the incentives that are given for those career moves. Those are, that's part of the world we work in. But they are also often used as barriers to change and barriers to collaboration and working on a level playing field, which is what's required in us today. A lack of accountability. Like, who's in charge? Teams are nice, but who's the team lead? Who's in charge and what does accountability mean? It's a barrier to facilitating change. And then those turf issues that trump teamwork. I once had a phenomenal, I guess I'd call it a gig, in an academic medical center. About 7 years ago, transforming a very, very large heme-onc clinic into a patient-centered clinic and experience for patients and families. and for staff. I've been at this for a long time. I thought I really did it well. I was working with everybody. We not only had the attendings involved and the fellows involved and the residents involved and the nursing staff involved and everybody who did anything in this huge clinic, but we had the patients and their families involved. We had it all. We did it all. Command centers, the whole thing. Until the reality hit some people that their schedules would change. Oh my God. I didn't walk into the garage late at night. Had no idea that no matter how well we did it, there was that last bastion of, you can ask me to do a lot of things, but one thing you cannot ask me to do. And I went to school on that. You know, you can learn even at my age. And it was a very interesting experience for me, because when I explored what had happened, I was reminded that people learn at multiple levels. And for some folks, what they were learning had nothing to do with what they expected to have to do. It was what they knew, not what they did. And so I had to do a lot of backtracking. And so having lived through a lot of this stuff, recognize there's a lot we face in the kind of changes that we're asking people to make in this age. So moving on, some considerations I asked you to have. Organizations don't change, people change. It's not bricks and mortar, it's us. And so no matter what discipline you are in, no matter what world you come from, no matter what lens you look from, you got to understand something about human behavior and not just your own. We so often underestimate change issues and uncertainty and the anxiety uncertainty brings people. We often simply underestimate it. We say it and we move on because we're all so busy. And there's not a person who doesn't know that uncertainty creates anxiety. Anxiety, people stop working well. And so we look to leadership to help us understand the world isn't coming to an end. These are very, very important considerations, because while often we know it, we don't grasp the implications of how we need to practice it. And so, there we go. On the other hand, it's not the end of the world, because I think that's how we've been looking at change for a long time. But right around the corner is the apocalypse. Just grasping that the way we have looked at things for a very long time is not how they necessarily are. And we are dealing with dramatic changes, and they can't be met with complacency. Some people are better at, if I may, as I said to you earlier, Zen than others. Right? Some people do Zen. It's a form of complacency. This is not one of those times. I think it's a very exciting time. I think it's a time for interest and energy and learning and breaking some old habits. And I don't know what yours are, but we've all got them. And so it's good to have some understanding of how we actually work. Now, for those of you who are in the, have invested in your lives, you're probably not unfamiliar with, especially given what happened in 2007, divestiture aversion. If you've heard of divestiture aversion, some people call it the endowment effect. What is divestiture aversion? Well, the hypothesis is that people value something more once their property rights to it have been established. This is mine. I should probably give it up. But I know it so well. And it helped, that fund helped send my son to college. Why would I give it up now? It's what I used to say about IBM. But what's the outcome of this is we place a higher value on the things we own and know than the things we do not. Because no one likes to lose. Divestiture aversion permeates organizations. I know how to do this. This is my work. These are my people. This is my equipment. This is my building. What do you mean we're going to another building? So there are a lot of things that get in the way of asking people to think about change. Not an easy thing to do at all. Resistance is present even when the goals are desirable. So people say, I know this is good. I know we have to do this, but not on my watch. And so we're looking for people to think differently today. I don't think any of us gets left out or left behind. So I'll tell you a little story, and you'll, I'm sure, understand why I share this, because I think it's an important one. There's a woman, it's a very sad case of having a horrific recurring dream. And I don't know about you, but some folks have recurring dreams throughout their lives. And her recurring dream had her, as she entered her 30s, actually, her recurring dream was about being in a room. She couldn't get the door to open and let her out. So, go quickly to your dream, dream diagnosis. Okay, she's stuck. Could be further than that, who knows? But anyway, she went to see a psychotherapist, and this was ruling her life, ruling her work, and she was simply polarized. And so he walked her through a lot of different things. A lot of things did not work for her. And so he chose something called guided imagery. And he asked her to put herself in this room that she went to in her dream, and asked her to close her eyes and walk around the room in her dream, and then approach the door slowly because of what this door represented. And he had her go to the door and try to open it. And he said, now look at the door, and what do you see? She said, oh my goodness, a sign that says pull. I could have had this dream because I'm a pusher. We all have habits that are unconscious. We all have a lot of habits. A lot of these habits we really like. Some of these habits, I think, can stop us in our tracks because it's hard to know not only what they are, but also where they came from. And so part of exploring organizational change and our personal willingness to move organizations through it is understanding some of the habits that are going to need to be adjusted or changed. So one of the things I've learned, and I've done quite a bit of studying about the last few years, is about the neuroscience of leadership. And, there's a neuroscience of everything now. Decision-making, leadership. But one of the things that really has come out of some of the interesting research on leadership in relation to change is that we know that, we've got this, basal ganglia who lets us drive home without looking. You ever drive home and get there and say, I haven't had a thing to drink? How did I land here? Because, we're thinking. So we count on that basal ganglia to get us through life because everything can't be new. Everything can't be new. We've got to be, we need certain things to just let us move along. But then there's that work and memory piece. That when we start comparing what we know to what we don't know, we tire easily. It gets frustrating. At Hopkins, at Bloomberg, it's biostats. We put people in these biostats courses for terms and terms and terms, and after they go through some of the worst pain of their lives, they come out, really happy and really knowing. But in the beginning, low energy because it requires so much of us. And so, one of the things that I take from change is pain, because when we're required to change, it can hurt. Because what we are doing is we're actually learning and unlearning. I published an article with a colleague a few years ago about a patient safety culture. And I used the word unlearning in the article, and they sent it back and said, this is not a word. Because it does come out of initially organizational studies. So we are in a time where there is learning and there is unlearning. And I'm not sure what it is you need to unlearn. Only you would know that. But some of those things are our habits. So some of the things we know and need to unlearn, which is a tough thing to do, are those habits we have, but oh so important. And so, after all of this, what would I like to leave you with? And there are a few things. I ask for those of you who are in a position to understand, to give up that default style of command and control and develop collaborative leadership skills. And you don't develop it elsewhere and then come in with them. Learning to work more collaboratively requires you to ask more questions. So start practicing asking questions. Think network, not turf. We all know about systems. We all know about networks. We don't think of them necessarily in our organizations. Number one. Number two, developing a greater sense of self-awareness and self-management. Leadership sets the emotional tone in any organization. Never kid yourself. It sets it in the country. It sets it in our organizations. And do remember, people do perform better and work better for leaders who are more positive than negative. Think about communicating to influence, not just communicating. If you're looking for people to listen to you and act on what you say, think about what you're saying and how you're saying it. You have a lot more at stake at their understanding what you're saying than they have at taking what you're saying and doing something with it. Make the case for change and why we need to leave where we are. Everybody doesn't get handed a burning platform. If we had them, it's a lot easier. Listen for what's important to others. I feel like I should repeat that over and over again. Listen for what's important to other people. That's why people, I have a friend who says, go rent a friend, he'll listen to you. We thrive on people's respect for us and they're listening to us. Listen to what people are saying and de-emphasize status hierarchies. And lastly, please consider focusing on building a culture of trust, what I call the glue. You are the only one, whether you're in the position or aspire to it, who will model transparency and let them know you're doing it. Let them know you're doing it. Express empathy and show vulnerability. We trust people who are willing to show vulnerability more than those who are chest pounders. And emphasize learning. And in an age of experimentation with what we need to do with practice and our organizations, try to minimize fear and punishment. And so that would be my way of saying these few things, I hope, can be helpful in your considerations of either embracing the role of leadership or adapting yours. Thank you.
So we have some time for some questions. So questions, Professor Goodenough.
This happens in class too.
So I have, I'll sort of start with a lead off. So for us, we see not only our organizations changing, but the field of radiology has a lot of change. And as we try to sort of model positive communication, for many of us have been hearing the sky is falling, I think, for quite a while. So how do you sort of take that and reframe it when there are sort of many challenges?
Okay. Well, I can't give you specifics. Language matters. And I think you need to be very conscious of the language you use in how you talk about the sky falling. Because if If you think the sky is falling, then it's legitimate, by the way, to think the sky is falling. And so it really is in communication. What is the language you choose? You do that, don't you, with patience when you're trying to communicate what the test meant, what the results mean, and what the implications are and the potential consequences of ignoring them. So you think about the language you use. So it would be very similar to how do you want to frame what it is you want people to think so that they move out with an idea that while the sky might feel like it's falling, here's what we can do to hold it up. So I hope that helps a little there.
Well, thank you. Again, I want any question? Well, I want to again have everyone join me in thanking you for wonderful lectures. Thank you very much for joining us.